Sie please welcome Emmanuel Danan, meine Damen und Herren.
Good morning, Folsom. You're obviously hangover. First of all, before we start, I get to make a really big announcement for Germany. Is anyone here on PrEP? That's kind of disappointing. PrEP access to Germany has been quite difficult until now, but I'm happy to announce that as of mid-September, PrEP will be available for 50 euros in selected German pharmacies with a private prescription. Finally. So, and now I'm going to welcome to the stage my panel. Please welcome the panel. We have one Dr. Matthias Winold, a physician who is part of the PrEP work class of Berlin-Brandenburg Physicians. We have Sven Lücke, who is a PrEP user and also the webmaster of PrEP-Jetzt. We have Alex Craddock, who was one of the founders of IWantPrEP.Now.co UK, which kind of started the whole PrEP movement in Europe. We have Felix Bertmann, who is also a PrEP user and quite active in the fetish scene in Hamburg. And we have Helge from Mancheck, our fantastic Berlin checkpoint. He is a preventionist. You can find him at many of Berlin's parties, giving information about risk reduction for drug use and sex. So we're going to be trying to answer the standard questions about PrEP that everyone pretty much already has read about, but we'll do it again anyway. And then the pesky questions that you get on Grindr and Geromeo. I kind of assume that today we have the biggest amount of PrEP users in Berlin that we've ever had. And those questions about PrEP are going to happen over and over again this weekend. So we thought we would just answer those here in order to save you the trouble later. You're also welcome to ask questions in German, in English, in French if you want, I don't care. We will do our best to answer. So the first question is going to be, what the hell is PrEP? What the hell is PrEP? Who wants to answer? Helge, go for it.
Perfect. So PrEP, predisposition prophylaxis, is a pill that you can take. The scheme that has been approved for is at the moment 1 pill a day, every day, and that protects you from contracting HIV, basically. And it's to a very high percentage of security also.
Okay. So PrEP is basically another way to prevent HIV. What is PrEP not? Please, Matthias, we want you to answer this question. There's a lot of confusion sometimes about PrEP, PEP, treatment as prevention, so Matthias is going to answer this.
What we really have to be clear about is that PrEP is another opportunity for HIV prevention. It's taken by people who are HIV negative. They have to test before they start taking the PrEP, have a negative test, and the PrEP then, the pills, contain a medication that accumulates in the body and that hinders the virus from settling in the body. Whereas other methods of prevention include taking medication after you've had a risk event.
That will be post-exposure prophylaxis.
Post-exposure.
PEP.
And another way to prevent the transmission of HIV infection, which we found 10 years ago, is that if people take their antiretroviral therapy therapy, that's HIV positive people, take their antiretroviral therapy effectively, they cannot transmit the virus, so there's no transmission possible.
Okay, and we call this task treatment as prevention. So don't confuse, like if you take treatment every day, you're not taking PrEP. PrEP is not a pill, it's a strategy, it's a prevention strategy. Okay, next question, which is a question we get very often. How effective is this? Like, is this as good as condoms? Is it better? Is it worse? How effective is it?
Well, studies show that PrEP is over 99% effective if you take it as you should. Obviously with lots of real life factors added in, such as you know, maybe not being in a good habit of taking a tablet every day and everything like this. The UK study found that it was 86% effective at reducing new HIV transmissions. I mean, if you're, a lot of people also recommend that if you're still worried about it, you can take PrEP in addition to using condoms as well to reduce this even further. Pretty much as close to 0% as you
can you help us understand here? You mentioned two different numbers, over 99%, then you said 86%. If people look at older studies, they're going to see 43%. Why do we have so many different numbers? What is the meaning here?
So some studies are under controlled circumstances. Some studies test, you know, taking a tablet in real life. Sometimes you forget, sometimes you lose your medication and don't take it for a week, or sometimes, you know. The studies that say over 99% effective, that is when the participant is definitely taking the PrEP exactly how they should. And then the other studies which say maybe 86%, this is when the person is given PrEP like you would have at the doctor, and then you go away for 3 months or something, and you know, as I say, real life happens. You maybe forget to take the pill or something. So it measures also, you know, how adherence, which is how good you are at sticking to the regime.
Yes. So I'll add to this that in the British study where they had this 86%, that was caused by three patients. Two of those stopped taking the PrEP and got infected a few months later, and one of them was actually already infected at the start of the study, but it wasn't detected. So basically, that's the difference between effectiveness and efficacy. One of them is how the pill works when it's taken, and the other one accounts also for people who would stop taking the pill but were still in the study. In all the studies, what they found is that anyone who has taken, there was no infection in anyone who has taken 4 pills or more per week. And that's why we say 99.999%. There's been, in the real world, until now, 3 infections only. If we think that there's been a few million fucks on PrEP, then that's quite an impressive effectiveness. Next question. So it's effective, but what about side effects? We get like a lot of people who are against PrEP just throw it in my face. Those HIV medications, they're terrible. They have terrible side effects. Is that true? Felix, you've been using PrEP for quite a while now. So how is your body doing?
Working. Okay. I don't hear myself, but... Gerade reinsprechen, yeah.
Okay.
So, actually, we are talking about the side effects. Side effects, so... PrEP, the most used medication for PrEP is Truvada. Sure, there are side effects that could happen. One is, for example, you have... Is it better? Oh, yeah. So, one side effect, it could be, I don't have the word for kneeling. The kidneys, yeah, okay, yeah, maybe. So, you have to be careful with your kidneys. So, if you're a PrEP user, you need to be, so you need to see the doctor mostly every second month or every 3 months, to take care of yourself, of your health, that you be sure to, side effects is not my thing. So,
talking about side effects. Well, I think the basic message is you won't start it by yourself. Don't start it by yourself in your own home and chamber and decide, I'm going to take PrEP now. Go to see a physician and talk to him before you start taking it. Because you may, number one, be using other medications. I'm using other medications, so I need to check whether PrEP is really the right, or Truvada is the right PrEP for me. If I'm taking other medications, I have diseases, the kidney was mentioned, the liver may also be something of concern. General checks that your doctor does before he starts you on a medication. When you're taking PrEP, the side effects appear to be very limited in comparison to what happens in people with HIV, and I'm grateful for that. And all people with diabetes, I wouldn't say it's a very easy medication, because you really need to check. It's not like going to the pharmacy and buying yourself an aspirin. But it is something that is possible, and that's possible for most people.
So I'm kind of a know-it-all, so I'm going to give the answer that I give on Grindr when I'm getting pestered with this question. The side effects question has to be separated into two. The short-term side effects, like what happens when you start, and the long-term side effects, like how can this destroy your body. So the short-term side effects, 1 in 10 people gets those. I didn't, so for me it was all fine. The side effects that can happen in the first 1 to 3 weeks are perhaps diarrhea or digestion problem, a bit of fatigue or headaches, but those go away after 2 to 3 weeks. And then users report it's like taking an aspirin, you don't notice it. The two long-term side effects that you need to know about with Truvada are, like we heard, about the kidney functions, which can over time decrease. It's not something that happens suddenly, so it's something that will be over a few months. That's the reason we want to go get checked at the physician every 3 months to make sure the kidneys are still working. If something starts to show up in the test, the moment you stop taking Truvada and wait, everything goes back to normal. So this effect is reversible. There is no long-term damage done from this if you stop in time. The second side effect is also reversible. It's a very slight diminution in your bone density of 1 to 2%. It's clinically insignificant because it cannot cause bone fractures. And again, the moment you stop taking Truvada, it comes back. You talked... What?
One of the things that we also need to mention is Truvada and PrEP is not a lifetime medication. So it's not a decision you're taking for the rest of your life, neither with Truvada nor for PrEP. It's something that you're taking over time. And it's nothing that kills you if you stop taking it. So I think it's worthwhile, the experiment, for somebody who wants to have it as an extra option for HIV prevention.
You mentioned not starting without seeing a doctor. I think it's also important to mention you have to do a few tests before starting. One of them is this kidney thing. The other one is make sure your hepatitis A and B vaccine is fresh and working. Because if you get hepatitis B, you can get some trouble with Truvada, with flare-ups. And what else? I think that's it. Now, to the question that's really interesting to most of us. Why don't you just use condoms, you sluts? I'm gonna let Sven answer this one.
Thank you. Well, first, if you are using condoms and if, you don't have any problems and are happy with condoms, there's no need to change your position. But however, we have in Germany every year more than 3,000 new HIV infections, and there must be a reason. And one of the reasons is that condoms are a border or a barrier, and many guys are not happy with using condoms. So, of course, you just could say use condoms, stop this bareback fucking, but this will not happen. It's not a solution. So. In order to get a decrease of the yearly HIV infections, we have to take other ways, and PrEP is one of this way, and therefore we should not just say use condoms. If there are guys who are not familiar with condoms, PrEP is the right way. It's not the thing of how many risk contacts you have. It's the point that you have risk contacts, and therefore you should use PrEP.
Alex, I want to widen this question. Yes, there are guys who don't use condoms, but again, why don't you? Why the hell don't you? Why aren't you being a responsible gay like the rest of us?
Well, it's very nice to think that we live in this world where everyone gets told to use condoms, and so everyone just uses condoms 100% of the time because that's what we should do. But in the real world, as everyone knows, people don't like to use condoms. People, you're in the heat of the moment. Maybe you don't have one on you. Maybe the condom breaks or it slips, or in the real world, condoms are not always practically used. For example, maybe you lose your erection when you put a condom on. This is a side effect of condoms,
Talking about side effects.
Yeah. So, it's nice to say that, to stamp on all of this, but, people have been trying to say use condoms for God knows how long, how many years now, and it's not enough. So, PrEP is obviously a new tool to add to all of this. If condoms are working for you, then great. But if condoms are not always working for you, and sometimes you have risky sex, then PrEP should be an option for you. And PrEP needs to be available as an option for these people where condoms are not always used 100% of the time when they should.
Also, I've been my whole adult life, my whole sexually active life, I've been very consistent with condom use. And I started, I think in October, I started with PrEP through a study, basically. And this, and also like the fact or the knowledge about being people who are undetectable, not being able to transmit the virus and so on. This, for me, had the effect of disconnecting the fear of disconnecting sex from death, which is, I think, something that is the consequence of the trauma of the AIDS crisis, and I think it's very much there for, and I think everyone knows what I'm talking about. The constant awareness that there could be an HIV infection while I'm having sex. So something that is supposed to be fun and supposed to be a pleasure used to have, even when I was very consistent in using condoms, used to have this connection to death, and used to have this connection of, if I fuck up, like this could fuck up my whole life. And I think that being undetectable, like the knowledge about that, and also PrEP have the capacity of doing a disconnect here. And I think that's a great thing in itself. Like, apart from like people who can't, like, who are not good with using condoms or who are not consistent with their condom use, I think for everyone else, this is something very good that is coming out of these basically medical developments over the last couple of years.
I have to agree. For me also, it's been a great relief of anxiety about HIV. And for the first time in my life, when I meet a guy, I'm not first trying to understand if he might be a risk or a danger for me. I'm actually like learning to get the person. Am I interested in him? It's very refreshing to have this capacity for intimacy, which I didn't have before because I was concentrated only on the HIV risk. We have a question for from the audience.
Thank you very much for giving me the possibility to ask also my question. We all know Truvada is a quite new medication, and I'm very curious. You just said in the round that Truvada as PrEP medication isn't really a lifetime medication, or it's not intended to be used as a lifetime medication. So I'm curious how and in which situation if you would switch and you would say, okay, now I need to overthink, is it just a medical situation from the side effects and adverse effects that the drug has, or is it also something what depends on your lifestyle that you say, okay, in this situation I would not do, or is it really sensible to say, okay, there are times when I need and should do a break, also for my own?
Well, two things. The first one, you said Truvada is quite a new medication on the market. I'd like to correct that because Truvada has been used in HIV therapy for 15 years now. So we have quite a lot of info on how it works and what effects it has. Now you ask about is it a lifetime medication? They talk about periods of risk. You take Truvada in periods of risks. Everyone has different periods in their life. Right now I am in a piggy period, so I do need to take my PrEP daily. But who knows, I might go to study in Greenland for a year and there would be no one to fuck there except penguins. So I won't need PrEP there. Or if I know I'm in an asexual relationship, or or I'm having cancer treatment and I'm chemically castrated right now, I do not need PrEP. The wonder about PrEP is that as opposed to HIV treatment, which you have to take, you can always decide, right now I don't need this, or it's having an effect on my body which I don't like, so I'm going to stop and try to use condoms again. And that's your choice. That's the great thing about it. Should we keep going? Should we keep going? Yeah, okay, we have another question here, please.
The next question is here. Yeah, one moment.
So we'll get the next one, all right?
So, okay, the question is that I'm standing here, all of a sudden it goes beep. I want to go have sex, I'm not on PrEP, and it's going to probably be bare sex. So, how much time of a window do I have to take PrEP before to be like 99% hopefully secure?
Who wants to take this one?
Well, the French did a study called the EPIGAY study, which studied this, basically there's different studies. Some people were studying you take PrEP once a day, but obviously this is not always sex is not always planned. So the French study, they said they tested basically, say you're going to have sex on Saturday. You take 2 tablets the day before, on Friday, 24 hours before. You take 2 on Saturday, you know, at the time you're having sex, and then one the day after, and one the day after. So from that study, and they also, this was obviously studying real-life situations, not controlled situations, and they saw that it reduced new HIV infections by 86%. So it's successful. So basically, 24 hours notice is the minimum recommended.
I'd like to elaborate on that. So assuming you are 100% certain you do not have HIV, you can take PrEP, what they call on demand. The normal way of taking it would be daily. There is another schema to take it, which is on demand, and as has been described, you've got to take PrEP in a window of 24 hours until 2 hours at the latest before your risky contact. You take 2 pills in that window, and then another one 24 hours later, and another one 24 hours later, for 2 days after your last risky contact. We have new information from this summer in 2017 that was presented at the World AIDS Convention. And they've shown that they've had no infections in that group taking PrEP on demand. Even in people who would take it not every weekend, but like had pauses of 2 months and then take it again. So we're getting more and more information that PrEP on demand actually works, but still we have less data than we have on daily PrEP, which is, the data on daily PrEP is certain, it's proven, it's beyond doubt. The data on demand is still coming.
Can I further expand on that? I think the question relates to the fact that you have pills at home and that you can actually take them. So first go to your physician, talk to him and make clear that you can take the pills. Then you consider for yourself, do I take them just for a weekend? That's the PrEP on demand thing. Or will I be taking it continuously? If you take it continuously, you start with 1 pill a day, and after 7 days, you're fine, you can go. There are some people where it's possible after 4 days, I give you right there. But because the drug is differently passaged in the body by different people, the statistics point to the fact that after 7 days, you have a go-ahead.
The next question here.
Last comment about this, in case we have some trans men in the audience or some trans women, these numbers are quite different. It takes a different amount of time to reach vaginal tissues, and there might be interactions for anyone who has gone through reassignment. So check up on the internet, there's information on that. Last question.
Hello, Stefan. Stefan is my name, and there's another very strong position which was promoted by NYU, and who has a very, very intense department following the AIDS crisis from the 80s and preventive medicine and side effects. What I would like to add here very strongly that Truvada is nearly taking HIV medication. So without being HIV positive, pharma is promoting to the gay population the medication as preventive medicine, and the side effects of Truvada are also proven that they reduce testosterone production. And so there is a huge movement starting up that they describe.
You will have to provide me studies on that, because I've read quite a lot about Truvada side effects. I've read nothing about testosterone.
It's a huge study that they're not 100% sure if it's a combination of one is it the medication and one is it the virus that creates a decrease of testosterone production. It's not clear. And the long-term side effects are also not clear. So,
hold my beer.
I think what's very important in your argument is that, yes, indeed, PrEP is medical prevention. And medical prevention doesn't come without side effects. I agree with you completely.
Right.
That's why I say talk to a physician. Physicians will value study results against real-time observations. And what we are seeing in real-time observations is that people with HIV, who certainly are in a much worse position when they start taking Truvada regarding their entire metabolism and their immune system, they show some changes in their body. But these changes, as you rightly point, are not related to any certain medication. But the question is, how can HIV medications be improved to not affect that? This is triple combination therapy. What we're talking about here is a monotherapy, and is with a drug that is very well known, also in its side effects and in its general tolerability profile. I would really like to talk about tolerability of PrEP, rather than about the side effects. Can we take it if we want to? It's an option. It's like taking the condom. The condom has its side effects. Can we take it if it's offered to us? And I think that's a very important decision to make. And thank you very much for that advice. But we are taking a decision.
And of course. But talk about the
So I know that we have to close now. Thank you for listening and staying here with your umbrellas. We're kind of safe. I'm going to give back the microphone to Ben. Ben, is he here? Yes, he is. Oh, what are you wearing? Honey, come up on stage. So we're going to be leaving you. Thank you very much.